Hi, my name is Paulina, and today I'll be reconstituting a drug and administering it via minibag. So I'm just going to perform hand hygiene here and go over my MAR. So my patient today is Emma Wrightson. She has no known allergies. She is admitted today because she has pneumonia, so I will be giving her an antibiotic. The antibiotic is Zithromax, 400 milligrams, via minibag. So I've already compared my doctor's orders to my MAR. They are transcribed properly, so I can go ahead now. I've taken my medication from Pyxis. The vial is not expired. The integrity is good, so I can use it. Also grabbed my reconstitution sterile water. It's also not expired, and the integrity is good. So I'm just gonna go ahead and do my first check. So my right patient is Emma Wrightson. The right drug is Zithromax. Right drug, Zithromax. The right dose is 400 milligrams. This is a 500 milligram vial, so I can get that from here. The right route is IV. This is an IV vial, and the time it's daily, so the time is now at 0900. So I'm just going to go over my drug monograph now. So it's azithromycin, or Zithromax. The classification is an antibiotic, thus the reason why I'm giving it to my patient today. It can be administered by a student nurse, so I can give it. The maximum single dose is 500 milligrams, and I'm giving 400 milligrams, so I can give it. And the usual is about the same, 500 milligrams, so that is good. It is supplied as a 500 milligram vial, and I will be adding 4.8 milliliters of sterile water for the injection for a final volume of 5 milliliters and a final concentration of 100 milligrams per milliliter. I will then further be diluting in a 250 milliliter bag of normal saline. I chose normal saline here because it's compatible with the primary that's hanging. Also, my patient doesn't really need any nutrients or anything, and I chose 250 instead of the 500 because my patient doesn't need 500 mLs. The 250 is a fine volume to give, and I will be giving it over 1 hour.
I'm going to inject it into my spring.
So the compatibility is it's compatible with normal saline, so that is good. Also, the potential hazards that I would be looking for are nausea, vomiting, diarrhea, and abdominal pain. So I will assess my patient for that before and after. So now I'm going to go ahead and do my reconstitution. So I have my vials here. I'm just going to swab them for 30 seconds and then dry for 15. So for the purpose of this video, 30 seconds is over, and 30 seconds is over, and then they're drying for 15. Using sterile technique, I will take out my syringe and attach my blunt filled needle. So I will be needing 4.8 milliliters of sterile water for my injection. So I will need 4.8 milliliters, or 4.8 milliliters of air. So I have that here.
Okay.
I will inject my air into my vial and drop that 4.8 milliliters.
So now I prepare my medication. I have a label here, and I'm going to attach this label to.
So I'm just going to get the bubbles out just to make sure that I do have the correct amount of sterile water in here.
Be careful not to cover any enforcement.
I'll scoop and swoop. Maintaining sterile technique, my needle did not touch the table.
I'm ready to go to the patient's bedside. My medication and all my
Okay, so I have 4.8 milliliters of sterile water in here.
I'm performing hand hygiene, and I'm doing a general safety check.
So now I'm going to put this into my drug vial. It is still clean, I have not touched it.
Side rails here, and I'm going to inspect my primary bag here. Primary bag's good.
And I'm going to let the air out.
And it's running at the correct rate. I'm going to introduce myself. Hi, my name is Destiny.
So now I'm going to gently roll my vial here to mix the medication. I'm doing this gently so that no bubbles form.
Some things just to watch out for with this medication.
And I'm looking for any sedimentation. There isn't any. It is fully dissolved, so I can now draw out my medication. I've done the math already for it. So I've done dose desired over dose over hand. My dose desired is 400 milligrams over my dose on hand, which is 100 milligrams per ml. So I will be drawing up a total of 4 mLs. So I'm going to get 4 mLs of air into my syringe. So I'm going to swab it again, just in case.
Redness, swelling, or pain at the site.
So I'll just swab in for 30 seconds and letting it dry for 15. Now I can put in my air.
So I'm going to do my third medication check.
And pull up that 4 mLs.
So I'm comparing my syringe to my mark. Okay, so I have here that it is the correct patient which I've identified.
Just gonna get the air out again to make sure of the correct dose.
Basics, correct drug, rosamide, 4 milligrams, which I have in here, 1 milligram.
Okay, so there's 4 mLs in my syringe. I'm now gonna go and do my second check with my vial. So my right patient is Emma Wrightson. Right patient, right drug is Zithromax. Right dose is 400 milligrams, which is 4 mLs, which is in my syringe, and I got from my 500 milligram vial. Right route is IV, this will be given IV, and the right time is daily, or 0900, which is now. So now I can further dilute my medication into my mini bag that I have chosen here. This is not expired, the integrity is good, so I can use it. So I'm just going to swab the end of it for 30 seconds and let it dry for 15. I have not touched the end. I've maintained sterility, so I can put my needle in.
Again, be careful not to touch either one. So I'm just watching.
This would go into the sharps, and now I'm just going to gently roll this just to make sure that everything, the medication disperses well. And I'm going to put my label that I previously made over top, not covering any important information. So my label has the patient's name, it has the drug on it, which is Zithromax, the dose 400 milligrams, and my volume that I pulled out 4 milliliters, but there's 254 milliliters in the bag now. For a final concentration of 1.6 milligrams per ml. I have the date, my signature, and the flow rate, which is 254 milliliters an hour. So now I'm going to get ready and go to the bedside. So I have my tubing, I have my tape for my tubing, I have my mini bag, I have my swab. Okay. So I'm entering the room now. I'm doing hand hygiene and a general survey, so nothing's on the ground, nothing's really in the way. My patient's in no distress or anything. So hi, Emma Wrightson. My name's Paulina. I'll be your student nurse today. Can you tell me your name and your birth date? Okay, and do you have any allergies? So I'm just comparing my MAR to the wristband here. So right patient. The fin is the same. The age is the same, and no known allergies. Okay, so I'm just gonna go do my third check now. So right patient, Emma Wrightson, which I checked already. Right drug is Zithromax. Right dose, 400 milligrams. 400 milligrams is in this bag. Right route is IV. This will be given IV, and the right time is daily. So right now, I can give it. So I'm just going to check. The site here, is there any pain? No pain. Okay, there's no redness, no swelling. It looks good. It's patent, so I can go ahead and give the drug. My primary is running here. The bag looks good. It's running at 30 milliliters an hour. Tubing looks good. Okay, Mrs. Wrightson, so I have your drug today. It's antibiotic for your pneumonia. Let me know if you notice any nausea or vomiting. These are just some of the side effects that I will monitor for. Here's your call bell, just in case. So now, my patient has the right to refuse. They haven't, so I can go ahead. So I'm going to lower my primary bag.
And just to ensure that the plunger is being depressed, and I'm going to continue to
I'm using sterile technique. I'm going to lock this off, and using sterile technique, I'm going to puncture my bag.
And I will continue to monitor for improvement of the patient's symptoms. They're looking at the log values, vital signs. I would do vital signs before I give this medication as well as after this medication. And
Okay.
I have my label here for my tubing. So it has my initials, date and time.
So I'm going to swab and use
Okay
the
guys,
port.
you have about 14 minutes left.
I'm going to swab the port above the pump because the pump will be going. Mine will be going through the pump.
This is done. I'm going to come back with 3 milliliters.
I'll be regulating it.
I'm going to connect it to
So swabbing for 30 seconds and letting it dry for 15. Using sterile technique, I am connecting it here.
Enters the patient so they get the correct dosage of medication.
So I'm just gonna back prime. Actually, I'm gonna put my tubing on, or my label onto my tubing,
So I've documented.
just so for future nurses know when
Call bells in reach.
when I hung this. It has my initials, the date, and the time. So I'm gonna back prime now.
Actually,
Okay, so my chamber is half full.
I guess I can try. Oh no, I don't know if I can. I put my label on there.
I'm gonna put my numbers in. So my rate will be 254 milliliters an hour. My volume is a 254 milliliter bag. Confirming the secondary. I will start it. I will be watching for 3 drops now. Everything is open. This is open. That is good.
So, do we have to switch over?
Okay, so I will be back when this is done in about an hour. And to make sure that my primary has kicked back in. I'll let my patient know, so I will be back. I might also monitor for about 5 minutes, just because this is the first time that she's gotten the med, so to make sure that no allergic reactions occur. I'll do my general survey out, and then I will come and do my documentation of the time and my initials.